Risk factors of stroke. So we have modifiable risk factors, potentially modifiable risk factors, and non-modifiable risk factors of stroke. The first one is modifiable risk factors. So for modifiable risk factors, let's understand that over here a few things are going to increase whereas a few things are going to decrease. So the first one, let's remember that in an Indian household, we consume a lot of sugar. As a result, there is increased sugar content in the body, resulting in diabetes mellitus. Then, we also consume a lot of oily stuff and meat, which increases the cholesterol levels in our body, resulting in hyperlipidemia. This hyperlipidemia will block the carotid artery, resulting in carotid artery stenosis. Then let's remember this stick diagram of a farmer who is also a smoker. So smoking, post smoking, he becomes hyper. So hypertension, and as a result he developed a heart condition which was called atrial fibrillation. And then lastly, there is something which will decrease in the body, which is decrease in the RBC count, that is the red blood cell count, resulting in anemia. What type of anemia? Sickle cell anemia. Therefore, to sum up, the modifiable risk factors of stroke include diabetes mellitus, hyperlipidemia, carotid artery stenosis, smoking, hypertension, atrial fibrillation, and sickle cell anemia. Now let's see the potentially modifiable risk factors of stroke. Let's remember this stick diagram of an obese lady. So first let's remember that this lady has a poor diet. Along with this, she is physically inactive, which further resulted in obesity. Further, she used to also abuse drugs. So which drugs? Oral contraceptive pills. Postmenopausal, she went for hormone replacement therapy, and over time this resulted in hypercoagulation of blood. So to sum up, potentially modifiable risk factors of stroke include poor diet, physical inactivity, obesity, drug abuse, oral contraceptive pills, HRT or hormone replacement therapy, and hypercoagulation of blood. Now let's see the non-modifiable risk factors of stroke. So here you can remember the word grafts. So G for gender, wherein males are more prone to develop stroke as compared to females. R for race, that is Africans and Americans have a high tendency to develop stroke. A for age, that is all those individuals who are greater than 55 years of age. F for family history. Let's skip the word T. Then we have S for socio-economic history. So to sum up, non-modifiable risk factors of stroke include gender, where males are more prone as compared to females, race in Africans and Americans, age who are greater than 55 years, family history, and socio-economic history.